My Lords, it is a privilege to speak in this debate today, and I thank the Minister for his thorough introduction. In the Old Testament, there is a beautiful vision of the prophet Isaiah of the perfect future with God. Never again will there be an infant who lives but a few days. No longer will people build houses for others and not live in them. People will not labour in vain, nor will they bear children doomed to misfortune. Whether or not you are a person of faith, I believe most of us could say yes to those words in the gracious speech about the government seeking in all respects to make long-term decisions in the interests of future generations. But how will that be realised? We need interconnectedness across disparate bills and indeed government departments, and a commitment to the well-being of individuals, always set within that big picture of people belonging together as interdependent human beings. Hence that word community and the importance of that in the gracious speech being picked up today in the themes of this debate. The gracious speech spoke not only of delivering a plan to regenerate towns and to put local people in control of their future, but also of the government's commitment to keep communities safe. All of this is only possible if there is joined up, holistic and long-term thinking. Discussions around local communities, housing, health and public services cannot be boxed separately from that stated commitment to keep communities safe. So I am unashamedly going to again mention prisons and declare my interest as Anglican Bishop for His Majesty's prisons. And I was delighted to hear the speech of the noble lady Baroness Burt. Prisons hold a mirror up to so much that is needed regarding housing, education and training, health, public services. On my most recent prison visit just a couple of weeks ago, the group of men I met shared their stories, mainly owned their failings, and named things that had contributed to their offending. Mental health problems, broken relationships, constant movement through the care system, a lack of housing which could be called home, addiction to numb the pain of poverty, lack of education and training, learning about crime in prison, and the consequences of a criminal record on even attempting to turn their lives around in terms of accessing work and housing on release. A focus on rehabilitation in prisons and beyond the gate is broadly lacking. Given that 2/3 of people in prison are there for non-violent offences and over half go on to reoffend within a year of leaving custody, rising to almost 2/3 among those sentenced to less than 12 months, it is failing everyone, not least victims, families and whole local communities, and it is not addressing serious contributory factors. For example, we know that the instability created by lack of or inadequate housing puts strain on families and communities and can create that domino effect, impacting health and education and many of those underlying causes of criminal behaviour. We also know that a high percentage of people leaving prison do so with no home to go to, and unsurprisingly, soon return through the revolving door of prisons. It's an expensive way to house people. In Gloucester, there is a business creating modular, eco-friendly homes, which incidentally employs prisoners. These homes could be the answer to so much homelessness, but despite the enthusiasm of police and crime commissioners and councillors, bureaucratic processes and funding stymie the possibilities. Combine lack of appropriate housing with poor education and training and a lack of adequately resourced addiction and mental health services, and the risk of offending is increased. And this is not about asking for more money. This is about redistribution of finance. On top of the annual cost of prison at £50,000+ per person, the social and economic cost of reoffending has been estimated at £18 billion per annum. while the cost to victims, families and communities is impossible to estimate and undoubtedly impacts on the pressure on health and public services, not least regarding the health and mental health needs of prison staff and their families. It's vital to see the big picture and refocus the finance. The very welcome government commitment to sensible presumption against short sentences will require redirecting funding to substantially supporting probation and community alternatives, which again link with the themes of today's debate. For example, community sentence treatment requirements aim to reduce reoffending by improving access to mental health and substance misuse treatment in the community. And there's some really good early data from pilot areas. Incidentally, as other noble lords have said, it's disappointing that the gracious speech didn't include plans to forward reforms to the Mental Health Act. Many women in particular are still sent to prison as a place of safety or for their own protection. This is inappropriate, expensive and does not lead to change, and prison staff are not equipped to deal with the levels of self-harm and disturbing behaviour. In recent engagement I've had with the justice system in the Netherlands, I've been struck by the focus on integration and reintegration, so different from the vocabulary of being tough and more punitive. There, people in prison from day one work on their reintegration, which includes plans for housing, purposeful work, health and care plans, plus a focus on a prisoner's social networks and family ties. The rate of crime continues to decline in the Netherlands. My lords, that wording of long term, which was used in relation to regenerating towns in the gracious speech, needs to be writ large across all policy and decision making in the themes of today's debate. There are no short-term quick solutions here. We need courageous, data-driven and joined-up decision-making if we are to truly change this country for the better. And it does not begin with tough law and order rhetoric.